Morton's neuroma. What is Morton's neuroma? Interdigital neuroma, more commonly known as Morton's neuroma or foot neuroma, is an entrapment of a nerve that passes into the toes of the foot. The nerve gets entrapped or pinched by the metatarsal bones, which are the bones just behind the toes. Factors that cause this problem include shoes that are too narrow, shoes with very flimsy soles, high heel shoes, foot structure, particularly those with very flat feet, occupations that require a lot of bending in the forefoot, such as those work low to the ground, such as plumbers or electricians, forcing them to kneel and therefore bend their forefoot for long periods of time. Symptoms of Morton's neuroma. This condition can be very painful. Typically, a person will be walking in shoes, although the condition can be painful out of shoes as well, and will develop a sharp pain just behind the third and fourth toes. The pain may be so severe that some have described it as a knife being stabbed into the forefoot. This pain may then radiate into the toes, usually the third and fourth, and manifest itself as overt pain, numbness, tingling or burning. This is the most common location for Morton's neuroma, but this condition can also affect the other toes as well. Other conditions that occur in this area of the foot may mimic neuroma pain with no actual neuroma present. A bursitis in between the two metatarsal bones may put pressure on the nerve and create neuroma-type pain. Secondly, a condition called capsulitis may also give similar symptoms as a true interdigital neuroma. Additionally, a metatarsal stress fracture may also create similar symptoms. Lastly, metatarsalgia pain can be mistaken for neuroma. Diagnosis of a neuroma is usually made on clinical grounds. Unlike most soft tissue lesions, for some reason an MRI can be deceiving in making the diagnosis. A diagnostic ultrasound tends to be a bit more reliable, but again can be problematic in making a diagnosis. Treatment of Morton's neuroma. There are a number of treatments for Morton's neuroma depending on the severity. Sometimes, just identifying the certain pair of shoes that sets off the pain and no longer wearing them will eradicate the problem. Anti-inflammatory medication can be helpful, but this should be considered temporary relief and should not be considered for long-term treatment. Orthotics. A foot specialist, podiatrist, may recommend an orthotic device, which is a sophisticated arch support, custom-made to the structure of the patient's foot. The purpose of which is to control the abnormal structural components of the foot, which are contributing to the condition. Many times a metatarsal pad can be built into the orthotic, which then attempts to spread apart the adjacent metatarsal bones and thereby remove the pressure on the nerve, thus reducing pain. I generally reserve this type of Morton's neuroma treatment for patients who are not candidates for other types of treatment. This type of therapy is the most conservative type available for this condition. Cortisone injection into the area can also be very helpful. Some doctors will inject cortisone in an effort to reduce the inflammation of Morton's neuroma. Denatured alcohol injections. 4% denatured alcohol injections given in a series, attempts to sclerose, or deaden the nerve. Cryosurgery. Another non-surgical option that has become available in recent years is the use of cryosurgery. As it relates to neuroma, the growth is frozen via the insertion of a probe into the area of the neuroma. This freezing of the neuroma deadens the nerve, thus eliminating the pain. The procedure is an office procedure performed under local anesthesia. The two biggest complications are misdiagnosis of the Morton's neuroma. The nerve is removed and the patient still has pain, or the surgeon removes what he perceives to be the nerve but by mistake removes a vein or tendon. The second, more common complication is not resecorting enough of the nerve and being left with what we call a stump neuroma. The patient will continue having pain while eradication of this new problem becomes much more difficult. Read the complete article at www.fot-pain-explained.com/mortons-neuroma.html